Good morning, everyone, and good afternoon and good evening to those of you who are joining us from outside the United States. You should be finding yourself on a panel on global governance and World Health Organization reform in the wake of COVID-19. This panel is sponsored by the Global Health Law Committee of the International Law Association. I am Fred Abbott. My co-chair is Bridget Tubes from the Netherlands. The Global Health Law Committee has been working on matters relating to the pandemic basically since the inception of the outbreak. As early as April 2020, we adopted a statement regarding the pandemic, which was subsequently revised and converted to a resolution that was adopted by the full ILA at the Kyoto meeting. Three of my fellow panelists are also members of the committee, Pedro Villarreal, Gianluca Berci, and Helene de Puder. And we are joined by a very honored special guest. We're honored to have her, Precious Matsoso, Dr. Precious Matsoso. I'll introduce them a bit more when we get into the proceedings. Well, it's certainly easy enough to be pessimistic about the response to COVID-19. We could generally conclude that the whole thing has been an epic failure. And in the report of the independent panel, there was certainly laid out the reasons why we might reach that conclusion. Basically, we came into the matter wholly or very nearly wholly unprepared, and there was no switch to simply flip and to address the matter appropriately. And matters since then have gotten somewhat better, but certainly not as well as we would like them to. But I would prefer that our panel not be conducted on such a pessimistic tone, that we rather look at this all from a more hopeful standpoint. There are a great number of things to be fixed, and hopefully we'll give you some ideas about how we might approach fixing them. There's been a great deal going on in this space, even just over the past few days. Apparently, there's been an initial draft prepared of concepts that may be used in a World Health Assembly meeting to be convened next month to consider the possibilities for IHR reform, WHO reform, and the possibility of negotiating a pandemic treaty. Dr. Tedros, the DG at WHO, has called on the G20 to dramatically scale up the amount of money going into COVAX and other areas to step up the provision of vaccines, therapeutics, diagnostics, oxygen, and other supplies needed to address the pandemic in countries in need. Dr. Tedros, perhaps a bit surprisingly, also at the same time, seems to have endorsed the idea of a global health threats financing board, which also comes out of a proposal from the independent panel, I think, recognizing, as many of us have, that financing is a very critical component of any preparedness, surveillance, and response for a pandemic, and we can't really leave that out of the equation. And just to reiterate, I think the independent panel for pandemic preparedness and response is responsible for much of the groundbreaking work in this area. This panel will proceed along what I would consider to be traditional lines. Each of the panel members will have 12 to 15 minutes, hopefully more toward 12, to make a presentation. Then we'll try to visit questions that may have been raised in the chat by audience participants, if technology allows, even perhaps using microphones. And then if there's any time remaining, which seems unlikely given that we have a total of 1 hour and 15 minutes, we may return for some closing remarks by the panel members. So let me start by introducing Dr. Precious Matsoso. I first met her in 2020 in South Africa at what we might say was the height of the HIV/AIDS epidemic and pandemic, which she was one of the key individuals responsible for turning around both the response in South Africa and the global response. She's gone on to have a really tremendous career in global public health. She was chair of the WHO Executive Board. She was Director General of the South African Department of Health. She was an official at WHO, and she's now teaching in her principal field, pharmacology and pharmacy in South Africa. But to today's point, she was a member, and is a member of the independent panel established independently under the auspices of the WHO. And so there's no one really better to address what the panel did and what its recommendations are. And so with that brief introduction, I will turn this over to Dr. Precious Matsoso. Thank you.
Thank you. Good afternoon. Thank you so much, Professor Abbott, for introducing me to this August occasion and audience of esteemed experts. I would like to establish whether can I do a PowerPoint presentation or can I talk to my presentation?
You should be able to post it. I mean, it's up to you.
Okay. Okay. Thank you very much. I will talk to my slides in that the independent panel, as you know, was established based on resolution 73.1, which was adopted by the World Health Assembly.
Precious, let me just interrupt for once. Are you posting them? Because we don't have them yet if you're posting them. And let me make sure with Angela that.
Well, I'll talk to them so that I save time. So,
Okay.
so the panel, but I will forward them for the record. It was based on the resolution that was passed by the World Health Assembly in 2020, resolution 73.1. It was led by the former heads of states, Madam Ellen Johnson Sirleaf and Prime Minister Helen Clark. And of course, it had a whole lot of other experts. But the process of panel work involved a lot of evidence gathering. And I'd like to emphasize that because the panel did not want to work on the basis of previous reports and so on. But the message was that the panel had to come up with bold and actionable recommendations. It had to look at lessons, but also look at what the impact and epidemiology was, and at national and subnational level, what the response was, and how well did the health system cope, and what about communities? And in most instances, when we talk about pandemics and epidemics as well as outbreaks, we tend to forget that outbreak starts locally. And when we respond, we leave behind the communities. So we had to also dive deep into communities and understand what the response has been, but also the socio-economic impact of this pandemic. We looked as well at the international system and the World Health Organization. I think the basis of that was that we wanted to build on the past, review the present, and understand what the impact has been, and come up with recommendations that will change the future. So it was quite intense in that we had hundreds and hundreds of interviews, roundtables, exchanges, and we also commissioned papers that were written, and we had a lot of submissions, about 140 submissions, briefings, as well as roundtables. And we brought in different experts from various fields. But we also have an authoritative chronology because we wanted to understand what happened from day one. and where did all go wrong, but without necessarily apportioning blame, because that was not the purpose of the work of the panel. So of course, like Professor Abbott said earlier, the world had been warned before. We had multiple reports that indicated that we had to be ready. But time was lost, and we have to ensure that in future, how do we deal with this? And the member states had a wait and see approach, and also, the delays and how science was used was also of concern. But at a global level, we wanted to understand the global leadership and coordination and how multilateral institutions worked and how WHO guidance material was used by countries, and preparedness was grossly underfunded. And this funding of preparedness is extremely important. And I'm happy that international financing has taken center stage. And this time around, we have to get it right and ensure that our planning and protection, particularly social protection, is addressed at national level. But of course, we've seen the inequalities, inequities, which I describe as terrible twins, as to how do we deal with these terrible twins of inequity and inequality. But of course, it wasn't all gloom, in that we saw some successes. One, in that there are countries that dealt reasonably well. There are countries that also ensured that their systems performed within their available resources. But also, it also showed us that vaccines could be developed speedily. It was unprecedented. We had never seen R&D moved at such speed. But also open data and open science collaboration was enabled. It had never happened at such scale. We have seen how digital tools were used and data analytics, something that we'd never experienced before, which were of the view that were positive lessons and also successes. But what I wanted to highlight was how health workers have been stalwarts in their efforts. To date, they're still in the forefront and they're still fighting to save lives. And from that perspective, we came up with recommendations. Recommendations, firstly, that we had to have immediate action to have equitable distribution of vaccines, ensure that there was technology transfer. And we deliberately said there had to be voluntary licensing and tech transfer because we wanted these vaccines to be produced with immediate effect. We didn't want this process to be held up in the negotiation process of the WTO. That process must take place to discuss the waiver. But we said, as that was happening, there had to be a parallel process where there was tech transfer and production of vaccines. We call for the immediate development of a roadmap by the World Health Organization and immediate funding to be released so that vaccines could be procured. And whilst that was happening, all the public health measures needed to be intensified, meaning we didn't need to let our guard down. We had to ensure that that process also continued. But at a more longer term basis, we wanted leadership to be elevated so that the global health threats could be adequately addressed at the highest possible level, where there could be accountability and multi-sectoral action. Because what we learned from this process is that COVID-19 taught us that this pandemic was not just a health problem. It affected all sectors and a multi-sectoral response was needed. We need the whole of government response, but we also need to ensure that all sectors pull together. We also needed to ensure that WHO was afforded independence and authority, and that it was adequately financed. But also investment in preparedness is non-negotiable. To prevent the next crisis from happening, we have to ensure that there is investment for preparedness. Establish a global system for surveillance, but also at country level. We must have an alert system that can give us data timely so that we can respond adequately and timelessly. But of course, the proposal was that Act A had to be transformed because it was not inclusive, and it had to be a truly global end-to-end platform. And this recommendation is being embraced because we hear that talks are underway to make those kind of bold changes. But we need an international pandemic financing facility. And we've heard that the WHO Director General is already responsive. And we are happy that G20 countries have also taken positive steps to ensure that this is happening. At national level, we need national pandemic preparedness plan developed as a matter of urgency, but led at the most highest level possible. It cannot be left to a junior official in the Department of Health because it's the whole of government. It needs to be kept and led at the most highest level possible. And in that respect, I would like to say that we still have to put emphasis on equitable redistribution of vaccines, and that as we discussed the IP waiver, we have to ensure that there's production of vaccines and these vaccines can be accessed. We have to ensure that there is a roadmap. We need to get and come out of this pandemic and start leading proper lives and lead those lives as we prepare for the next pandemic and as we make sure that we are not worse off than we are now. I thank you.
Well, thank you very much, Dr. Matsoso. That was an extremely comprehensive and far-reaching vision. And I just pick up on your point that really the whole of government needs to be engaged because the health department typically doesn't have the power to control the financial levers and to move other areas of the government around. So you really need to get everybody involved, and coming from a higher level would naturally be a good way to make that work. So I appreciate that. We'll come back to these questions presumably in our discussion. Let me next introduce Professor Gianluca Burci. Gianluca is currently an adjunct professor at the Graduate Institute in Geneva, where they have been doing a substantial amount of work on pandemic preparedness, surveillance, and response. But for present purposes, probably better known to us as the longtime former legal counsel of the World Health Organization, where he was very deeply involved in all of the important negotiations and providing legal guidance. And I understand that he has put his toe back in recently. And so, but he's going to discuss with us the various notions, potentials for reform, institutional structures, legal arrangements, and what he thinks might be the way forward. So with that, Gianluca.
Thank you, Fred. Thank you for inviting me. It's the second year in a row that I'm participating in the International Law Weekend. And it's an initiative I was very fond of. When I was living in New York, every year I attended the International Law Weekend, and I spoke a couple of times about very different topics like UN economic sanctions and peacekeeping. So now health is dominating the headlines. Yes, so what I would like to do is, in particular for people that are not following what's happening on a daily basis, to give a bit of a sense of what the state of the art is on the international law angle of all the governance debate going on pandemic preparedness and response. Precious has given an excellent summary of the IPPR, which also made recommendation in this sense. So first of all, I think I don't have to say too much on the fact that COVID has shown systemic weaknesses in basically all aspects of international law and governance. You said it at the very beginning, was an utter failure on basically all fronts, both upstream on the causes of the pandemic, but also downstream on the effect, on the implication, the consequences. And as usual, when we have a big shock, and I must say there have been several shockwaves in global health in the last 20 years, from HIV/AIDS to the H1N1 influenza pandemic to Ebola and now to COVID. There's always a plethora of reviews and recommendations coming from more institutional groups like the IPPR, of which Precious was a member, but also academic initiatives, think tanks, and so on. So there have been also no shortage of findings, conclusions, and recommendations from different directions. Obviously, I'm not going to even try to summarize them, but I think that there are some recurrent themes that I think leads me then to talk about more the legal angle. The first is a need for better governance, both strengthening WHO, but also beyond. And as usual, there's always a tendency to propose new bodies. There is a crisis, let's have a new body. The second is questions of power and control. And here you have the G7 and the G20 that have been very clear about trying to control politically what can happen in the future, in particular in financing, but also approaches on using existing global structures like WHO, the financial institutions, and so on. The third is the question of financing, as Precious alluded to, both national capacities, but also what we call global public good. The fourth is a question of equity. Inequity and inequality, Precious put it very well, are the terrible twins. And that is very evident on access to what we call medical countermeasures, personal protective equipment, diagnostics, therapeutics, but in particular when it comes to COVID vaccine. The fifth is a balancing between public and private authority. We see the excessive power handled by the pharmaceutical companies, but also the effect, the role played by the Gates Foundation and so on. So there is a strong need to rebalance the public versus private. And finally, and that leads me to the main part of my presentation, the need for legal rules. We don't get out of this only with institutional proposals or political declarations. We need legal rules that creates a sense of commitment and create accountable and enforceable obligations. So from this perspective, the action right now is centered on WHO. There is a working group that has been launched by the World Health Assembly in May, has held 3 meetings, will have the 4th and last meeting next week, and report to a special session of the Health Assembly at the end of November that comes with high expectations of launching a new intergovernmental process that should, for many people, be centered around negotiating a new treaty, a pandemic treaty. Being entirely online, which doesn't facilitate multilateral diplomacy. Not everything, frankly, is love and roses. There's a lot of mistrust, but that's multilateral diplomacy is for you. So I thought what I would do is to give a bit of an update, a bit of a critical update, trying to summarize, at least the way I see it, where the discussion is going and what are the main arguments. First of all, the discussion has been dominated since early this year from the push for a new pandemic treaty. This was launched in earnest by the European Council and strongly supported by a number of European countries, Germany, France, the UK, Italy to a certain extent. There is a group called the Friends of the Treaty, which is about 30 countries from basically all WHO regions. A lot of support. Director General Tedros has been an early convert and is a strong advocate for the treaty, which, by the way, creates an awkward situation for the Secretariat that is supposed to support the working group, be neutral, independent, impartial, but the boss walks around the world advocating for the treaty. Not easy for my colleagues, but also has been supported basically by all the reviews. The APPR supported it, the IHR review committee, and so on. So it's quite a lot of traction. What's interesting is why such a strong push with a very, very quick pace about the treaty. And the Europeans were very frank. Basically, they said, we have a window of opportunity, but the window will close soon. And so we need to move fast, and we need to create an initiative that will attract sustainably the attention of head of state and head of governments, that all of government approach that you were mentioning. And that's, Prime Minister get not excited by revised international health regulations. So a treaty was seen a bit tactically as a way to fill that governance void, and also put the European Union at the center of a political space that had been dominated by the toxic relationship between the US and China. There was a void to fill, also the EU perceived. It's fair to say that after a moment of shock and awe, there has been a bit of a growing, if not resistance, at reluctance and questions asked. There are several low middle income countries that frankly are still uncertain what this all means. There are some prominent skeptics, in particular the United States, but also Russia, Brazil, and many sort of left-wing NGOs that are suspicious and see this as a possible attempt to divert attention from more revolutionary issues of equitable access to vaccine, for example, the IP waiver proposal in WTO and so on. So there is convergent, but there is also, frankly, big divergences. There are three main issues, I think, in the work of the working group and the way the conversation is going. First, why do we need a treaty? Second, what about existing instruments? Why do we have to jump into something new when we have the international health regulations, but also other international legal regimes outside health, trade, intellectual property, transport, environment, human rights? And finally, what is the content? So we need a treaty for what? So the main arguments in favor of a treaty basically have been, we need to fill a gap, a substantive gap, but also a government gap. We need to generate and channel the high-level political commitment that only a treaty can fulfill. The international health regulations are too narrow, are too technical, are too much the sandbox of ministries of health. There's a low compliance, low effectiveness, there's no accountability framework. And so there's been a bit of a dismissive attitude at the beginning. At the same time, the friends of the treaty had not been fantastic communicator. The proposal has been kind of vague, opposed to the US that has come with an extremely detailed proposal on how we should focus first on the IHR and then maybe in the future on the treaty. But these are the main arguments in favor. What about the substance? I would make 10 points here. There are many proposals flying around, as I said, with different level of vagueness or details and several nuances, but I think they can be grouped in 10 categories. The first is zoonotic risk and One Health. Most of the big diseases from HIV/AIDS on have been jumping from animals. So we clearly have a problem, and I agree that we have a blind spot in international law. The second is national preparedness, clearly lacking both in developing as well as in developed countries. And this obviously linked with assistance and financing as a fundamental ingredients of building and maintaining preparedness. The third is transparency and good faith, information sharing, notifying WHO, cooperating, doing the things that many countries reproach China not having done enough early last year. The fourth is empowering WHO, give it more teeth. For example, in sending verification missions to countries where there is an outbreak. Being quick, that's something that Precious mentioned before, rely on social media, on ITs, being bolder, use a precautionary approach, and so on. So empower WHO, but make it more accountable. The fifth is access to pathogens, a topic that you, Fred, know very well. Pathogen, including genetic sequences and also benefits. The discussion on this has been dominated by the impact of biodiversity law, in particular the Nagoya Protocol, and many people see it as a golden opportunity to carve a regime which is more responsive to the needs of public health. The sixth is coordination on travel and trade measures. There has been an utter failure in the last 20 years. But obviously here there is a role for other organizations, like WTO. Not everything can be centered in WHO. The 7, again, is equitable access to countermeasure. That's the elephant in the room that, in my view, can be a deal breaker, because many low and middle income countries are very clear they will not engage if you don't have clear guarantees that it will not be lofty rhetoric or charity, but that there will be a substantial change to how the pharmaceutical market is run. The 8 is accountability, compliance, and enforcement, something that has been missing. People have been talking even of sanctions, but there's clearly an accountability gap to fill. The 9th is governance and structure. There is this dogma in global health that every treaty has to be a framework convention. So also here we have this constant refrain, but sort of structural issues and how to have states leading the management of a new instrument. And the 10th is financing. And these have been linked to proposal like what Precious said before on the International Pandemic Financing Facility, G20 proposal, the US and Norway come with their own proposal for an intermediate fund and so on. What are the counter arguments? And I'll finish with that. The first is, let's be careful. Don't throw away the baby with the bathwater. We have the IHR. We cannot dismiss them. They will not be shelved somewhere. They remain the centerpiece of global health security. We need to strengthen them, preserve them, not duplicate them, amendment if need be. So I'm relieved that in the discussion that I witnessed, there has been a lot of support for investing in the IHR, not casting them aside. The second is a fear of fragmentation. Be careful of new instruments, new institutions, new initiatives that just add to the confusion. So again, an emphasis on first, let's look at what we have, let's strengthen it, and then look critically at the real gaps. The third is equity. I mentioned it before. Many countries want guarantees upfront. The fourth is forum. Is WHO the right forum for this? WHO is the constitutional and political limitations. What about topics that do not fall within the core of WHO's mandate? What about a UN convention? Can there be an interagency approach? For example, One Health, which is a fundamentally interdisciplinary approach. And then the urge to look outwards. Geneva is very self-referential. The diplomats here get a very silos approach, but there is a need to connect this IHR and treaty narrative to the broader landscape. So what is happening now? Where are we going? There is a growing support for a parallel process, for having the Health Assembly at the end of November launch a new intergovernmental process that will look at the IHR and at the same time start working on a pandemic treaty. It's a very ambitious initiative because not many countries can play adequately on two tables that will look at each other, will try to coordinate with each other. But if you look at it from a logical perspective, in my view, it makes a lot of sense, because if you need to have complementarity between these two regimes, then to somehow put it under the same tent has some appeal. So there are big expectations about what comes out of the Health Assembly. It will be the beginning, not the end. At the same time, there are divergences, there is mistrust, it's not the best time for multilateralism. And so there is also the fear of a failure at the Health Assembly that will clearly send the wrongest possible message. But I think we can be mildly optimistic, not the doom and gloom that you were mentioning when you introduced the panel, but I think the convergences are bigger than the divergences right now. So I'll leave it at that and happy if there are questions later. Thank you.
Well, thanks so much, Gianluca. That was really a brilliant summary and set of recommendations for which it is self-evident that we could convene a semester-long seminar touching on each of the topics that you've addressed, and we're not going to have time for that. The one thing that I would just throw for discussion, if we have time, is that I imagine we're all in agreement that this is a broader matter than can simply be addressed within the WHO as such, and you know, perhaps the logical alternative space is the UN, but you know, again, these are sensitive subjects. The question is, and this goes back to comments you already made in 2015, and when we were in the midst of the Ebola crisis and the not jumping into new instruments, if we do need to link up the various institutions so you have a coordinated pandemic response approach, be that the IMF, the World Bank, the WTO, the World Health Organization, well, many others, UNDP, FAO, and so forth. Can you conceive of a linking mechanism that it does not, in fact, involve a treaty, right? That would involve conditions and triggering mechanisms that don't require that same type of detailed negotiation. So that's a pretty big question, but we don't have time for it now. And we will shift then to Dr. Helene de Putter, who is senior lecturer in law at Bourgogne-Franche-Comté University in France. She has done some really outstanding work. She's done a great deal of work on pandemic preparedness and response, including questions like travel restrictions and precautionary principle and other important elements. She's a member of our Global Health Law Committee, and I believe she's going to talk to us today about sharing of pathogenic resources and principles of equity. So I turn that over to you, Helene. Thank you.
Thank you, Chair. And I'm very delighted to be with you today, and very honored as well to have this opportunity to participate in the American branch meeting of the International Law Association. So as you said, I'm going to focus my presentation on the necessary promotion of equity as a principle in international health law and on its translation into concrete legal norms. And Gianluca called equitable access to countermeasures a deal breaker. So I think it appears necessary to think about equity, to formulate it into legal terms, and to make it independent from charity, as you said, Gianluca. I'm going to launch a PowerPoint presentation. Yeah, so I think that as international lawyers, we have an opportunity with this COVID-19 pandemic to think about what are the principles, or at least the emerging principles at the core of international health law, which is a branch of international law which has been quite disregarded so far. And as you said, Fred, during the meeting, the ABILA meeting in Kyoto last year, I made a presentation on the precautionary principle, and my point was to underline that international health law should be irrigated by a reasonable dose of precautionary measures, especially regarding travel and trade. But today I would like to focus on equity. Equity as a concept that could be transformed into a principle of international health law. So, despite several countries saying that vaccines are global public goods, these vaccines are everything but global public goods. And as we say in French, facts are stubborn things. One dose of vaccine in state A to a 35-year-old man healthy with no comorbidities means that an overweighted man of 65 years old in state B will not have access to this dose. So this is the opposite of what global public good means. And the COVAX initiative has been enabled so far to be a real game changer. And despite the WHO Director General calling for a moratorium regarding booster shots until the end of the year, some states are already delivering a third dose of vaccine to their citizens, while other countries have not delivered a single dose yet. So this situation reveals a lack of equity in access to pharmaceutical products. But interestingly, the need for equity has been largely acknowledged these days by states. For example, Charles Michel, the president of the European Council, at the World Health Summit, has declared that a new international pandemic treaty would specifically guarantee equity. And more importantly, equity is also mentioned not less than 10 times in the zero draft that was released yesterday by the intergovernmental working group that Gianluca mentioned in his presentation. And what is interesting is that, and I quote, you can see on the slide, members of the working group have agreed that equity is a priority area because it is at the core of the breakdown of the current system. So, although equity is a concept yet to be fully recognized as a principle in international health law, we see that it is being largely called for, in particular by this specific intergovernmental group, at the point where we could see maybe the outset of an emerging principle in international health law. And I think we have a unique opportunity with all the discussions currently going on in Geneva to promote equity as a principle in international health law. So, of course, it won't be enough because then we need to give teeth to the principle by translating it into concrete legal norms, legal terms. And this can seem an ambitious proposal, but I would like to draw your attention on the fact that we won't start from scratch because we already have a concrete example of an equity translated into concrete norms instrument. And this instrument is the PIP framework. So the PIP framework in the long form is the Pandemic Influenza Preparedness Framework for the sharing of influenza viruses and access to vaccines and other benefits. It was adopted by the WHO as a recommendation in 2011. And as indicated by its name, the PIP framework relies on two pillars. The first pillar is the sharing of influenza viruses at the global level in order to identify the virus which will be responsible for the next pandemic, and then tests and vaccines and antivirals and so on can be manufactured to fight this specific virus. And these tests, these vaccines, these antivirals are called by the PIP framework the benefits. And the second pillar precisely is access to these benefits. And the objective of the PIP framework, and I quote the PIP framework, the objective is expressly to ensure equitable access to vaccines and sharing of other benefits. So this is the equity translated into law that I was referring to. And further on, in the core of the text of the PIP framework, the PIP framework gives concrete guidance on what equity means and on how we should apply this concept. As you can see, according to the PIP framework, equity means to prioritize developing countries as well as particularly affected countries according to public health risk and needs. So equity is not left as an empty shell. It is translated into concrete guidance, into concrete criteria. And let me explain for those of you who doesn't know the PIP framework, how all of this functions. So the PIP framework relies on a global network of laboratories, which is now called the Global Influenza Surveillance and Response System. So every day, all of these laboratories are responsible for the surveillance of the influenza viruses, and they collect samples, they share the samples among each other, they analyze the samples, and ultimately they try to identify which influenza virus is going to be responsible for the next influenza pandemic. And this virus will serve as the virus of reference to create and manufacture the vaccines, the antivirals, the tests that will be needed to protect people from this pandemic. So to be very concrete and illustrative, imagine that the Brazilian National Influenza Center detects an influenza virus from a patient, they collect it, and then they send it to the collaborating center based in Atlanta. Then the Collaborating Center of Atlanta assesses the virus and concludes that this virus may be responsible for the next influenza pandemic. So there is a need to launch the manufacturing of vaccines, antivirals, and tests that we call the benefits. The goal of the PIP framework is to make sure that these benefits are shared in an equitable manner based on public health considerations and on needs. How is it possible? Well, one needs to understand that benefits are generally produced by pharmaceutical industries outside the network. So if an entity outside the network, for instance, Sanofi in my slide, wants to have access to the influenza sample in order to launch the manufacturing of the vaccine, this access by Sanofi will only be possible if Sanofi has previously concluded a legally binding contract with WHO, whereby Sanofi agrees to contribute to the fair and equitable access to this vaccine. And this contribution by Sanofi can take various forms. For example, option one is that Sanofi can agree to donate a certain percentage of vaccine to WHO. For example, option three, Sanofi agrees to donate antivirals to the WHO, or option five, the voluntary licensing that Mrs. Matsotso were referring to. So you see there is a different kind of options that Sanofi can choose. And here is an abstract of the contract concluded by Sanofi with the WHO. So you can see that Sanofi accepted in advance to donate 7.5% of its vaccine production to WHO and to reserve 7.5% of its vaccine production at affordable prices to WHO. Secondly, the PIP framework imposes on external entities like Sanofi, which benefit from the network, to pay what we call the annual partnership contribution. It means money, which is partly used to help countries improving their national capacities as required by the international health regulations. So what is interesting here is that equity is not only an interstate thing, and it is not based on charity, like Gianluca said. It directly involves corporate social responsibility through a contribution from the private sector itself. And this seems quite fair, considering, for instance, that for the second quarter of 2021, Pfizer's net profit increased by 59%. So I think the PIP framework deserves attention from us lawyers and also from states. Currently, the scope of the PIP framework is limited to influenza viruses with pandemic potential. So a virus like SARS-CoV-2 does not fall into the scope of this instrument. But this instrument should definitely serve as a starting point for a global mechanism on pathogen sharing and equitable access to pharmaceutical products. And I think this would be a great achievement in support of the implementation of the right to health. Thank you.
Well, thank you very much, Helene, and for reminding us of the Pandemic Influenza Preparedness Framework. I think that several of us on this call were involved in those negotiations at one level or another. I would remark, though it doesn't mean anything conclusive, that the negotiations started out, at least from an access standpoint, with a much more ambitious target than was eventually reached. And the results were fairly widely considered disappointing in that regard. But of course, one always has to start someplace. and a great deal of time and attention was focused on how the mechanism works. So as a mechanism, it's a good starting point, but in terms of equity, I think we need to do a little bit more work on pushing that, which I assume that you do as well. Well, I shouldn't put thoughts in your head. With that, I will turn to Pedro Villarreal. Pedro is a senior researcher at the Max Planck Institute in Heidelberg. He's done a considerable amount of work on the international health regulations and other aspects of WHO regulations. He has worked on concepts of redefining the pandemic and how you reach a determination about the declaration of an international emergency of public health concern. And I think that's what he's going to be talking to us about today. And so I turn it over to you, Pedro. Thank you.
Yes, thanks so much, Fred. And that is indeed the topic of my talk today. Good morning, good day, and good evening, everyone, depending on where you are. It is a pleasure to join you in the Ages of the International Law Weekend at the American branch of the International Law Association. I would like to express my gratitude to the members of the organizing committee and of course to Frederick Abbott for the invitation to join this very timely discussion. And as Professor Abbott was mentioning, the topic of my talk today, and also closely related to that of Gianluca Borchi's previously, is to bring us to the first step of actually defining what it is that we are facing at a particular moment. Now, it goes without saying that the COVID-19 pandemic would fit any and all definitions of a pandemic. But if we are to discuss and if states will negotiate a new instrument that tries to address some of the shortcomings we have seen, well, the new instrument will have to also keep in mind that future events, as past events indeed, may not look like COVID-19, so may not present the same features. They may entail a different epidemiology of the disease at hand. So in order to keep this to keep any legal norms sufficiently flexible to be able to cover all of the events that may emerge in the future. So how can we then define that which we want to regulate? As Gianluca Borchi mentioned previously, some of you may have seen that a so-called zero draft has been circulated for discussion at the upcoming special session of the World Health Assembly in November. And although it does not have all the definitions in place at this point, among the several positions is that, well, both a new legal instrument by way of a convention under Article 19 of the Constitution of the WHO, or generally a treaty, as well as reforms to the existing international health regulations, could be explored as options. It's not an either or exercise where we have to choose one and the other one is immediately discarded. As Gianluca Borchi was mentioning, well, there will be challenges, of course, if both options are explored, challenges for the negotiations. This is a cumbersome procedure, even if it was in only one instrument. But let us assume that there is an interest in either seriously overhauling the international health regulations or creating a new legal instrument that then poses the question, so where could this new legal instrument go where the IHR, where the international health regulations cannot? And Ms. Precious Mazzoso, Gianluca Borchi, and Hélène de Putter have all given us indications of what a new instrument could explore that the IHR maybe could not. And I would focus on one topic that might become a key challenge if a new legal instrument is pursued, and that's a big if. We do not know at this point whether there will be an impetus for such new legal instrument, but we do know that a new legal instrument is likely, could be aimed at addressing events that are currently not sufficiently covered by the international health regulations. We can keep in mind that we have had so far 6 public health emergencies of international concern under the international health regulations. And the previous 5, so the previous 5 of these emergencies, H1N1 influenza, Ebola in West Africa, poliovirus in the Middle East, Zika in the Americas, or Ebola in the Democratic Republic of the Congo, are in many ways not comparable to the COVID-19 pandemic. We didn't see the scope that we now live directly with COVID-19. I mean, none of us remembers having to resort to these online events, for instance, because the ongoing pandemic would made it unwise to travel around the world to the extent it has happened with the COVID-19 pandemic. So how do we then address such challenges like COVID-19 that seem to be quite, at least from a matter of degree, quite different from the previous public health emergencies we have seen under the international health regulations? So we will inevitably have to face the question, well, how can we know when we are facing such a scenario like the one with COVID-19? What kind of indication or what kind of criteria will we have for the future where the international community of states can have clarity on what it is exactly that they should do and how should they respond to the new event like COVID-19? And this brings us to the definition of a pandemic itself. Now, if we remember what happened in 2020, when the virus spread across the world, it started spreading in China in December and January 2019 and January 2020. And, we can remember that a public health emergency of international concern was declared since 30th of January 2020. And yet, most or not all of the governmental officials seem to have paid attention to this declaration by the WHO Director General. Some of them did. We do have data and evidence showing how certain governments did respond or at least react in a certain manner to this declaration. But others said, well, okay, fine, it's a public health emergency, but let's move on. Let's see what happens first. And yet, eventually, the WHO Director General declared that the spread of SARS-CoV-2 was a pandemic later on the 11th of March, 2020. And this statement, not the previous one that is a public health emergency of international concern under the international health regulations, which is the definition embedded in a binding legal regulations, not that definition, but rather the other one of a pandemic, which is currently not enshrined in any legally binding agreement. This declaration was the one that most governments paid attention to, perhaps because the virus was already circulating across almost all of the continents. But what is exactly a pandemic? It seems to have marked a before and after, in the global response. But what does it mean that we are facing a pandemic, and what are the consequences of one being declared? In fact, the independent panel on pandemic preparedness and response, also where Ms. Precious Matsozo was also participating. This panel already highlighted why definitions are important, and including the one of a new suspected outbreak with pandemic potential. And this term, suspected outbreak with pandemic potential, was partially retaken by the current zero draft that was circulated. As it mentions in its terminology, outbreaks of disease with pandemic potential. So it seems that there is an indication of a need to tackle these events that acquire a global dimension as opposed to public health emergencies under the international health regulations, which can be outbreaks that do not transcend territorial borders. So it's a different type of event. And that is why we had already 6 such emergencies, and only 2 of them have been pandemics, the H1N1 influenza pandemic and now COVID-19. So since there is no definition of pandemic enshrined in any binding legal instrument, Rather, it is visible in legally non-binding guidelines formulated by the World Health Organization. Hélène de Putter mentioned the PIP framework, and she mentioned how several of these, for instance, contracts or agreements with pharmaceutical companies often or at times allude to a definition or a declaration of a pandemic by the WHO. And in case a pandemic is declared, for instance, for influenza, which had been the focus before COVID-19 of pandemic preparedness, in the case of influenza, several agreements with pharmaceutical companies have clauses which will be activated once the WHO Director General declares that there is a pandemic. But then if we do not have a clear-cut definition so far, especially in one that covers events other than influenza pandemics, so where does that leave us? And what clarity can states have, moreover, of how to react whenever a pandemic is declared? So this would be one question. So if we are indeed to prepare to enhance preparedness for events like COVID-19, which again may require a different response than other public health emergencies, at the very least, the international community of states should have some clarity regarding, okay, when can we be certain, when can we know that we are facing a pandemic, and therefore we should act in a certain manner. So a first element of the discussion can be whether specific consequences should follow the declaration of a pandemic. In the past, as I said, certain clauses in contracts with pharmaceutical companies have been activated once a pandemic was declared, not a public health emergency of international concern under the international health regulations. So in a similar manner, instead of having contractual clauses that may or may not be present on a contract by contract basis, should WHO member states be obliged to act in one way or another, or refraining from acting in a certain manner, respectively, once a pandemic is declared? Should certain international funds be deployed to support countries with insufficient public health capacities to face a global threat? And if the declaration will have legal consequences, and as it currently does to a certain extent in the case of influenza, if these declarations then have consequences, we can assume, of course, that this will place a lot of power and authority on one person, which is the WHO Director General, likely. So should we then think of ways to ensure that the legal power to issue a declaration of a pandemic is properly exercised? What type of safeguards could we put in place to ensure that the risk of misusing this power is diminished? We don't want a misuse that can lead to unexpected or even counterproductive consequences. So these type of questions, right, the questions that take us back to defining what it is that we're facing at a certain moment, can emerge again, depending on how these discussions at the upcoming special session of the World Health Assembly evolve. So it may be that if a new instrument is pursued, they will have to face the challenge of really clarifying, okay, what type of events do we want to cover under this definition? In any case, hopefully we will not experience another pandemic similar to COVID-19 in our lifetimes again. Hopefully, we can never know, of course, because this is a matter of probabilistic assessment and events that may or may not occur, but it is much better to be prepared for if and when this happens. And this begins with having clarity on what it is exactly that we are facing and how should we react in the future to such events. I thank you for your attention, and I look forward to an engaging discussion.
Well, thank you very much, Pedro, for reminding us of the importance of definitions. And I think we saw quite a bit of discussion, if not controversy, regarding when and whether it was appropriate to declare a public health emergency of international concern at the WHO during the last series of events. And I suspect that one of the things people will be talking about is just exactly how that process should work, and are there methods of improving it, objectifying it, and other potential means for addressing it. And as you suggest, maybe we need to have a second category of things that's a pandemic, rather than just the declaration of emergency. I am going to stop us for 1 second here and ask Angela. I am required by the statutes of the organizers to allow a 30-second intervention so that she can post a slide about CLE credit. So for those of you in the United States who are seeking CLE credit for this event, please take note of what is on this slide. And I'll give you another 10 seconds or so in case you want to take a screenshot or a iPhone camera shot of it so you have the relevant numbers. All right, Angela, I think we can call that a day now on that. All right. So we've had an incredibly rich presentation of ideas here. We did have one question raised in the Q&A. I'll say it's regarding the relationship between HIV and addressing the current pandemic outbreak. I think we're all familiar with the fact that there are a range of conditions that may affect people that will increase their vulnerability and or their susceptibility to serious disease based on their pre-existing conditions. I don't know if any of the panelists want to further address the circumstance with respect to that relationship. We
Well,
also oh, go ahead.
I can give it the first shot. I mean, we do understand that this particular virus has, because of its mode of infection, that it presents comorbidity problems even with other disease conditions. It's not just HIV, as you know, because of the ACE inhibitor site where it acts. We've seen how the cytokine storm happens, and the comorbidity with other disease conditions like diabetes, cardiovascular diseases, cancers, and HIV is not the only one. So I think we should look at its relation to other disease conditions, not just HIV. Thank you.
All right, and we have another question in the chat regarding the definition of a pandemic. I'll assume directed to Pedro. Should it be embedded in a new public health treaty, or can it be incorporated into an existing framework? Should it be defined at all, or would that be limiting to a response for anything less than a defined pandemic?
Yes, thanks so much for such a great and very tailored question. But the wording itself indicates that indeed this is, has been well thought, and because it does strike at the core of the challenge, in the sense that indeed, I mean, one of the challenges for defining a pandemic is that there is no universal consensus among the medical and public health community on a definition of pandemic that can exhaust past, present, and future events that will be a pandemic. So how do we attach, for instance, quantitative indicators and not just a qualitative indicator, meaning, okay, you have vague terms like it has a global spread, but when do we consider something to be global, from which point onwards? And there is no mathematical threshold for this. And at least, well, there hasn't been a consensus within the medical and public health community so far. And well, in any case, if we do expect to have additional clarity than what we currently have. So what we currently have is, again, a definition which is very vague. And could it be then in a new treaty or a new legal instrument, or in an existing framework? So if we're speaking about just simply a definition, right? Just the definition as such, I think it can be both. The difference being, of course, that if there is a new legal instrument that enshrines the definition of a pandemic, it will likely be so that certain consequences or certain obligations within this new treaty what might be applicable if and when a pandemic is declared. If it isn't under an existing, let's say, non-binding framework, okay, maybe we will have indeed clarity. So maybe we'll, and this again, with the assumption that we can reach consensus in the scientific community, we can see consensus in the medical, epidemiological, and public health communities on what is a pandemic. So a definition would nevertheless be useful. But as rightly pointed out on the question, and I'll close with this, so the risk is that if we make the definition too constrained or too specific, so if it's so specific that we really limit it or introduce mathematical thresholds, we might run the risk that future events that look differently than COVID-19, and they might exist, then we might be limiting the response that we want to offer until those requirements of the definition are met. And if we are very strict in the definition, we risk leaving out a certain response. Thank you.
Thank you very much, Pedro. We have one hand raised by, I guess it's Jack Todd, or it's kind of hard to tell, or Todd. Anyway, I don't know if you can activate your mic, but if you have a question, please make it brief, because we just have another couple minutes before we conclude. Okay, maybe that was inadvertently raised. All right, Helene, I see you have your hand up, so we can start with you, but let me just note, we literally have another 2 minutes. So if each of the panelists, well, Pedro, you just spoke, if each Helene, Precious, and Gianluca could just for 30 or 40 seconds make their concluding remarks. I deeply regret we have so little time, but please, Helene. You're muted.
Sorry, thank you. I was saying thank you, and that there is another question in the list, but I want to go on with what Pedro was saying about the definition of a pandemic. I mean, I don't think we have to over-regulate, and I would be very cautious about trying to put things into boxes. As lawyers, we love putting things into boxes because that's the way we think. But I think it's dangerous to over-constrain natural phenomena into legal terms for 2 reasons. One reason has been recalled by Pedro, because then it leaves no room for flexibility, and natural phenomena requires flexibility because they can be surprising, they can take unforeseen forms. But secondly, also because then if we have a definition, it becomes a political issue with pressure to declare or not to declare a pandemic. So I would rather trust the common sense on the definition on pandemic and refer to the dictionary definition. A pandemic is a large epidemic, and I think it's enough, actually.
All right, so we literally are told we have to leave within the next minute. So Dr. Matsoso.
Well, thank you so much. I just wanted to reinforce the point about equity, that perhaps one of the focus this time around is to address equity. And I agree with Helene on the question of equity. And maybe with these discussions and these 2 parallel systems, they should focus on equity. Thank you.
And Gianluca Bershi.
Yes, 30 seconds. Picking up on something you said, Fred, and it's one of the questions in the Q&A about the importance also non-binding instruments. Everybody's been obsessing about this treaty business, but there is an important role to play for both political instruments, in particular as a coordinating framework. That's the topic you raised before, Fred. And also the PIP framework shows how formally non-binding instruments can have quite a big, empirically speaking, a big impact and shape not only the behavior of states, but also of market actors. So that's a dimension not to forget. And I hope that it will be part of the policy conversation. Thank you. Excellent panel.
Well, and let me just second that with the last word. This has really been an exceptionally broad and comprehensive discussion and raising of the many issues that are involved. We obviously haven't been able to explore them in depth. I hope we'll all have a chance to do this further at another event or opportunity. But I really want to thank all of the panelists as well as the audience for taking the time to be with us today. So thank you. And with that, we'll sign off. Thank you.